Imagine you are in the final stretch of your OET Speaking roleplay. You've taken a thorough history for unexplained weight loss, and you are just about to transition into your Stage 3 management plan. Suddenly, the patient leans forward and drops a brand new symptom. Doctor, I forgot to mention, I've also had severe chest tightness since this morning. Your stomach drops. You look at the clock. There is only 60 seconds left. Your mind races. Do you abandon your management plan and start taking a full cardiovascular history from scratch? Or do you push forward with your agenda and risk failing safety netting? When late-stage symptoms appear out of nowhere, many candidates panic. They abandon their entire consultation structure, reopen a diagnostic loop, and let the 5-minute timer run out. But you don't need to freeze, and you certainly don't have to let a late curveball ruin your exam score. Let's look at what happens when a candidate panics under exam pressure. Dr. A hears chest tightness at minute 4 and immediately reverts to history taking. They start asking about radiation, onset, and associated sweating. Within 45 seconds, the consultation clock expires. Notice what was sacrificed. Because Dr. A reopened a diagnostic investigation at minute 4, they never explained the weight loss treatment plan, they never arranged follow-up bloods, and they delivered 0 safety netting instructions. The main reason for the consultation was left completely unresolved. From an assessor's perspective, this mistake creates severe damage across your official scorecard. Reopening a diagnostic history at minute 4 causes a major failure under providing structure, while leaving your primary treatment plan unfinished loses critical marks in information giving. When candidates run our free timeline integrity audit, over 70% discover their timing isn't failing because of their English skills, it's failing right here at minute 4 when a curveball hits. In this masterclass, we are going to fix that exact structural leak so you can handle sudden symptoms with total clinical authority. If you've ever felt derailed by a sudden late symptom during your medical English preparation, understand this: it isn't an accident. The interlocutor isn't trying to trick you or make your life difficult. On their roleplay prompt card, they have an explicit directive that instructs them, if time permits near the end of management, mention a secondary concern to test priority triage. They are testing your ability to manage clinical time under pressure. They want to see whether you panic and let your management plan collapse, or if you can maintain control like a senior clinician. To master OET speaking for doctors, you need an automatic system for late curveballs. We deploy a 3-step method called the Triage Intercept. Instead of opening a brand new diagnostic history at minute 4, you execute 3 precise moves. Step 1 is the immediate emergency rule-out. If you've ever felt derailed, you ask by a sudden late targeted safety during your medical English to verify there is no acute danger occurring at that exact moment. The interlocutor isn't trying to trick you or make your life difficult. You validate their concern warmly, on their role so the patient feels completely they have an explicit directive while holding your main consultation agenda. If time permits near the end of the history, is mention a secondary concern to test priority secondary symptom directly. They are testing your ability to manage clinical time as an immediate post-consultation action. They want to see whether you panic. Let me show you how this sounds in real practice, or if you can maintain control like a senior clinician. Listen to how tone and authority completely shift between Dr. A and Dr. B. First, Dr. A experiences a timeline collapse. They say, "Oh, chest tightness? Okay. When did that start? Does the pain go into your arm or neck? Are you feeling short of breath?" The 5-minute timer expires while Dr. A asks basic diagnostic questions, and the primary condition is left unmanaged. Now, listen to Dr. B execute the triage intercept. Dr. B says, "I appreciate you sharing that with me, Mr. Palmer. Just to ensure you are completely safe right now, are you experiencing any severe shortness of breath or radiating pain at this exact moment?" The patient replies, "No, doctor, it's just a dull tightness." Dr. B then says, "Thank you, that is very important, and we are not going to ignore it. What we will do is secure your management plan for your weight loss right now, and immediately after our discussion, I will run an ECG and check your blood pressure before you leave today. How does that sound? The patient replies, "That sounds very reassuring, doctor." Notice the specific language shifts Dr. B used to maintain absolute control. First, asking "at this exact moment" isolates immediate life-threatening danger from background symptom history. Second, saying "we are not going to ignore it" completely allays patient health anxiety. You aren't dismissing their concern, you are prioritizing their care. Third, offering an immediate post-consultation ECG turns a potential timeline derailment into a high-scoring safety net that satisfies incorporating patient perspective. Now, before we look at your final pacing timeline, understand that this framework isn't just for chest tightness. It works across every late curveball the exam throws at you. Imagine you are wrapping up a diabetes review at minute 4, and the patient suddenly says, "Doctor, my knee has also started throbbing terribly since I walked in." You apply the exact same triage intercept. Step 1, rule out acute trauma. You ask, "Are you able to bear weight on it right now?" Step 2, the park and pivot. You say, "I understand that is uncomfortable, and we will absolutely look at it. Let's finish your insulin adjustment first." And step 3, priority deferral. You tell them, "As soon as we wrap up, I will examine the joint before you leave." You protect your timeline every single time. In OET Speaking, minute 4 belongs strictly to your management plan and safety netting. Deploying the triage intercept takes less than 20 seconds, keeping your consultation perfectly on track for a clean finish. If you want to know whether your timing structure is vulnerable to test day pressure, don't guess. Run our free 60-second interactive timeline integrity audit below. Select the specific communication liabilities you tend to drop under stress and calculate your exact structural risk score. If you find your timing is leaking on a specific scenario, run the audit, then drop your biggest test day friction point in the comments below so I can help you fine-tune your script. Click the link in the description, secure your timing structure, and I'll see you in the next masterclass.